Join the conversation.
You're with Cape Talk.
Before we talk to a South African doctor building breakthrough apps, and we're talking about Dr. Joandre Klopper, some very practical ideas have come through for the conversation and the occurrence of accidents on a Kloofnek stretch of road between the CBD and Camps Bay specifically. Alison says, why isn't there a mini way bridge on the Camps Bay side of the road? There is some space there. There is some space there indeed. And I know that way bridge would mean every little suspect truck is not going to take that route. So that in itself is going to be a solution. Yes, Alison Tucker. And then Trevor Booth says that maybe just there is a misconception on a distance or timing that it takes from a predetermined starting point, and that is the intersection at the V&A waterfront, the major intersection there, coming in on the upper freeway. It says if you take the Kloofnek Road, it's going to take you 18 minutes to Camps Bay. If you are going to take the coastal road through Sea Point, it's going to take you 19 minutes. So there's, or rather 17, 19. So there's a 2-minute difference in those two, kind of roads that you can navigate. And yeah, so it's not really much that you're taking out of the equation. Maybe there is a perception that it's quicker, and clearly from what Trevor has sent me now, a map, it's only 2 minutes faster than the coastal road. And so not a big kind of challenge in terms of productivity for those truck drivers that need to get to their destinations. It is time for us to talk about groundbreaking apps, African solutions for African problems. And Dr. Joandre Klopper from Sponsor Medic is showing us the way. Welcome, Doctor. It's great to have you with us.
Good morning, Clarence and listeners. How are you doing?
Very well, thank you. It's a beautiful day, 28 degrees around Cape Town. Dr. Klopper, you and some friends also, are they medical doctors, have kind of colluded to bring some solutions to the table. Tell us about them.
Yes, first off, please just call me Joandre. So yeah, you can just call me Joandre. And yes, it's been an interesting journey. We over the past year, we've been building solutions to different problems that we've been seeing in the public health system. My background is I'm a medical doctor who worked in public clinics and public hospitals. And while I was there, I became very aware of several challenges that the system was facing and that the doctors were facing that was impacting the quality of patient care. And we live in a country where, you know, the world average physician concentration is 1.5 doctors per 1,000 people. And in South Africa, it's 0.8 per 1,000. So we've got very few healthcare workers compared to how much work there is. And we realized that we need to start thinking of different ways to get the work done, because we cannot, Einstein said you cannot solve problems with the same thinking that created problems. And unfortunately, we are not in the position as a country where we can just throw more money at the problem. We need to start thinking, how can we work more efficiently, and how can we do more with what we have? And exactly as you said, South Africans building South African solutions to South African problems. I'm a very big advocate of, picking up the tools and building solutions.
Absolutely, and they're very practical, and if they apply to South Africa, they apply to the continent in so very many instances. So the medical field has been a hotbed of innovation, given, the backlog that we have on this particular continent, and it's exciting stuff. Let's talk about your locum app and under-resourced hospitals especially. Talk to their needs in relation to locums.
Yes, perfect. So I want to preface by just saying that the locum situation we're facing, it's what we've done is we've created a non-profit organization called Sponsor Medic. And what we realized is that there are many companies in South Africa, in the private sector, as well as various trusts and foundations and philanthropists who really want to help government facilities. And we see that often there are donations and things coming through, but at the end of the day, what we need is more healthcare workers. I was quoted recently saying that, we don't need prettier wall murals. We need more people working in the hospitals. And, that is kind of where Sponsor Medic started. Is we were sitting around and we were talking one day and we realized that, there's this big disconnect between the money in private and people that want to help the public health system and the public health system. And that is for two reasons. The one is that, unfortunately, people don't trust government institutions. So there's a lack of transparency and accountability perceived in the private sector, and that is preventing a lot of people from donating to the public health system that needs the money. And the other thing is people don't always know how to give. It's not very clear always. There are some hospitals that have trusts like the Tygerberg Children's Hospital Trust and the Grooteskier Hospital Trust that have set up non-profit trusts which they can use to, raise funds for their hospitals. But, every hospital and clinic in the country cannot set up their own trust because it's expensive and it's a whole process. So we thought to ourselves, the clinic in Ceres that has staff shortages, they don't have the time to set up a non-profit and go around looking for donors. And that's where we come in. We created the non-profit and we basically advocate for the hospitals, and we also use the money that we raise from corporations and businesses to hire doctors and nurses and midwives to go into the public health system, to work in the clinics that are struggling. And we've seen amazing results because of it. In one hospital, the average waiting time to be seen for green patients decreased from 17 hours to 7 hours on a Saturday night. And that is remarkable. And that just goes to prove that, when you know the system you're working in and you get the resources in, you can make a big difference.
We hear you, Jandre. I think we want to understand this app, but there are other things that I want to come to as well. Things that you have invented nearly to bring relief to especially, again, under-resourced hospitals. So these under-resourced hospitals would need a locum. And how would they normally get it? And your app, how does it benefit the process of achieving that necessary resource?
Yes. So let me preface by saying that we were unfortunately misquoted in an article recently that says that we're using an app for Sponsor Medic. We do develop apps, but the locum process actually works just normally through email. So usually what would happen is the clinics would email a locum agency and say that they are short-staffed, they need extra help, and then the locum agency would send an invoice, and then the clinic would get a locum and pay for it.
Yeah.
And that's where the big problem is now. It's not necessarily that there's a issue in coordinating locums. The problem is with paying the locums, because the government health, there's a wage shortage of about 8.4 billion rand reported last year. So that's the main issue, is the fact that there's not enough funding.
So that under-resourced, that hospital doesn't have money to pay the locum.
Exactly.
So they're not going to get the locum.
So they're not going to get a locum if they cannot afford one, and that's where we come in.
So there's going to be no healthcare, no professional healthcare in that particular hospital. That's where you come in. You crowdfund. So you fund that locum to be at that public healthcare facility.
Yes, 100%.
Okay.
That is exactly.
I think this is just absolutely marvelous. You're an NPO, so we're not talking about business model here. We are talking about getting healthcare to the most marginalized South African.
Yes, 100%. And I mean, we've had doctors in Mitchells Plain, Ceres, Atlantis, Parel, and we're looking to get doctors into Khayelitsha this week as well. And part of our work is we go to the hospitals. We are healthcare workers by training, so we know a lot of these facilities, but it still breaks our heart every time we go in and we see the conditions in some of the places, because there just isn't enough money to help people the way we want to. And, we as doctors get taught a certain way. We get taught how to treat people, and, we get taught how to, what is the best treatment for our patients. But in a system that is under a lot of pressure and a lot of strain, we often struggle to deliver what we want to, because a lot of the things are out of our control.
Yeah, there's two very interesting voice notes, or no, text notes in via WhatsApp on 0725671567. I think this one talks to the question that I was going to put to you. Hi, there are so many locums. My daughter is one example. Are there qualified doctors that are waiting for work that you know of, and that's why you're able to deliver the service so effectively?
Yes. So in South Africa, we've got about 600 unemployed doctors at the moment, which is directly as a result of the fact that the public health facilities are struggling to hire enough doctors. So in the Western Cape, we have a lot of locums. We work with the locum agencies that are on tender with government. Examples of that would be Employ, Health Staff. And then when the hospital needs someone, they would contact us and we'll arrange with the locum agency to send someone. And like I said, our role as a non-profit from Sponsor Medic side is we act as a financier and we act as an accountability partner for the hospitals. So our work is not so much on the coordination of the staff, but it's on the getting the money and reporting the impact to businesses so that the businesses know what is happening, that there's accountability and transparency.
Sure. We got Dr. Joandre Klopper, my guest. We're talking about Sponsor Medic and some innovative solutions that they've come up with to some of the healthcare issues. Just Warren Moon Vala suggests that we need to direct our effort and our energies not just in terms of the symptoms that we are encountering often in public health institutions. He says the health system has disempowered communities. We don't need more health workers in hospitals. We need more knowledge sharing through promotion and prevention to prevent communicable diseases. We will never have enough medical staff and hospital beds. Our population is growing too fast. Prevention of disease is the better option. Deal with upstream factors, maybe the Eastern healthcare model as opposed to the Western healthcare model, or maybe a little bit of the best of both. What do you say, Joandre?
Yes, so I am a very big proponent of preventative healthcare and primary healthcare, so we are definitely in agreement on that. Unfortunately, it takes time for those changes to have effect. For example, a child that comes in today at the hospital with, let's say, TB, meningitis, unfortunately, they are going to need a doctor tonight. And for that child, preventative healthcare has already, unfortunately, been delayed in that sense. So we understand that, yes, that is 100% correct. We need the systematic change or systemic changes. We need a lot of big changes, but there's definitely a place for putting a doctor there now as well, and a nurse and a midwife, because unfortunately, we've seen the impact of healthcare shortages on mortality and patient waiting time, and there's a lot to be done.
Yeah, so the curative needs are absolutely important, and we need to bolster our capabilities there, and the preventative is also very important, like the doctor has said. Jill says, thank you, Clarence. It takes an interview like this one to raise the spirit and a reminder of what incredible young South Africans we have. South African solutions for South African problems, indeed. And Dr. Joandre Klopper and friends, Dr. Matt Tavata Noordi and Fred O'Donnell are such South Africans, such Africans bringing those kind of solutions. So many that you are working on. One such product Joandre is developing is an intubation device inserted into the airway to keep it open, of course. And it could cost private hospitals up to 40,000 rands. And Klopper says Cape MedTech can sell them for 800 rand. A prototype currently with the South African Health Products Regulatory Authority for approval. That is innovation. And sometimes, it's simple, the solutions that we need. Is it not, Joandre?
Yes, it's interesting. I often speak with engineering students about the topic of frugal innovation. I prefer the term pragmatic innovation because frugal often has such a negative connotation, and pragmatism is such a noble thing for me.
Absolutely.
How do you do more with less?
Absolutely.
And I feel in Africa that is such an important skill to develop. So the specific device you are talking about, that is part of my, we have a medical technology company as well, where me and my co-founder Darshan Naidu, we work together on software and devices. We don't have a device on the market yet because it has to go through the SAPRA process before we can sell it. But we've got a device that, as you mentioned, it is there to help healthcare workers and paramedics specifically to intubate patients. And what we see is, so just a quick recap, intubation is when someone is, for example, unconscious or they've got swelling in their airway and you need to put a pipe down the throat to help them breathe. And what we see is in the wealthier countries like the US and in Europe, that it's quickly becoming standard of care in the ambulances to have video laryngoscopy, which is just a big word for having a little camera that shows you where the tube is going to make sure it's going in the right place. And in South Africa, we have that in some facilities, but that's mostly in private. And, I see it a lot in private hospitals. You see it very seldom in public hospitals, especially.
Joandre, it's only 800 rand as opposed to 40,000 rand, and this is the kind of solution that you've brought to the table, and that's going to empower so many health professionals to deliver much needed needs. There's an app called Enable, which provides the same functionality as a hearing aid using a smartphone and earphone. That's phenomenal. There's Triage Buddy, another app Klopper and his team are profoundly and particularly proud of, which uses an algorithm to help nursing staff eliminate errors in initial emergency care triage. This is the kind of stuff that is necessary. And we've got incredible leaders like Dr. Joandre Klopper and friends, Dr. Matt Devata Noordia and Freddie O'Donnell. They are there finding those kind of solutions. Because the solutions often come from Europe, which, of course, the lie of the land is very different. But that's where we've got to wrap it. Thank you for your time. It is now time for news coming your way at the top of the hour.